So as a parent, I'm really interested. I'm intrigued in what success looks like. So you be honest with me, guys. I mean, what are my realistic expectations as a parent in terms of the sort of outcome I could expect from your 2-week program?
We've yet to experience anyone who's left our program and regretted that they've participated. That being said, there's always a difference in how people respond to treatment. So you can look at it purely on a psychometrical level, and there we see that 60 to 80% actually have a substantial improvement in their in symptoms and in function level. Now the function level is your behavior and how you do in school, how your relations are, and on the symptom level, that's the level of depression and anxiety and hyperkinetic disturbance you have. So we usually have a fairly good response when it comes to symptoms, and we have a fairly good response on function as well. However, the outcome will be a lot of times also related to the follow-up, how parents and the kids manage to utilize the tools we give and the guidance we give after the program.
All our recommendations, which is actually quite hard, but if they do, all people will benefit from it, and all people will feel that this have had a substantial impact. But of course, all is about motivation, and if people want to send their kids to us to fix them, this is not the right program, because this is a transition, and it's a transition for the family, and it's a transition for the kids. So everybody needs to be involved in it, and everybody needs to be motivated. And we work on motivating the parents, but we also work on motivating the teenagers. And to some extent, we get to motivate them. They're 30% motivated when they come to us. That's fair enough. Some are 100% because they have, nodded their head to the wall for many years. So it's different. But motivation is key, and we are very keen on, before the program, trying to find out what is your problem, what is your main issue, what is your main, where does it hurt the most, and then we try to work on that through the program. And when it comes to outcome, of course, for a young adult who use too much drugs, that would be, not using any more drugs. For family, where the troubles in the family are quite high, a lot of conflicts, we will measure it on conflicts going down, and they will see, well, our family are now back together. And for kids who are not in school, it will be obvious to see if we're back to school. So we talk about development. We want their natural development to continue as good as we can. And we have our program doesn't last for many months, but it lasts enough to make progress if you're motivated. And the progress it's intense, so people need to engage in it. We don't have time to motivate our clients for 14 days and then start therapy. So when you participate, you gotta get ready for therapy.
You gotta hit the ground running, basically.
Yes, you do.
Internal data gathering, that we have similar results. So 60 to 80% of all our participants have a significant improvement in both function and symptom impairment, to both name their emotions and express them in a constructive manner. So our main therapeutic kind of framework is within the psychodynamic tradition of psychology, but we have a lot of focus on communication, observing and regulating your own emotions, and also expressing them.
And
the fact that we know that the physical activity in itself is therapeutic. It counteracts depression, it counteracts anxiety, it makes you feel better about yourself. Being in the wilderness, being in nature, in and of itself, also has a therapeutic effect. Studies have shown it lifts depression, it counteracts anxiety, and it gives you self-confidence. Now, psychotherapy is one of the main treatment modules for anxiety, depression, self-confidence, these things. But if you mix that with nature and physical activity, you get something that's greater than a whole, that's greater than the parts. So this is the kind of conceptual framework of all wilderness therapy, and you can kind of fill it with different schools of psychology, and a lot of times you need to kind of tailor the approach to the clients. So we're quite passionate about seeing the client's family and their individual needs. So we try to fill the program with the therapeutic approach that we think would work best for them. But a lot of times this will be relational work, emotional work, and working with communication.